Dr. Madhu is here. An amazing work, and we have seen his work being presented in different forums across the world. Always nice and proud to see him presenting. One thing, I was just a judge at uh, the apple tree. One of the major mistakes we do is a lot of people say that we have applied for patent. The question is, many things in AIOS is recorded. And if you go to the patent office, the first question is that do you have it being recorded or in the public domain? And if you say yes, even if it's a path-breaking Nobel Prize winning everything, your patent does not hold good. So even here, if you have anything which you feel is to be paid, you're planning to patent or applied for something, your patent office will, and first thing the lawyer has to tell you is to look, don't present anywhere where that is going to be recorded. And we have no control on what is going to be recorded or what is not going to be recorded. So please be careful about it. We had two similar instances at the apple tree, and both of them said that they've applied for patent, but this is, you can't just take out one thing out, and because it becomes public domain. So please be careful about this, Dr. And try to keep it as closely tight as possible. We can spend more time discussing this.
Yes,
Okay,
yes.
Dr. Madhu.
Thank you, sir. Thank you for the wonderful opportunity. So in the next few minutes, I'll try to share our journey of using a smartphone-based specular image as a slit lamp attachment. So why there is a need for this innovation? You see that we have specular microscopes that are costing around 10 to 15 lakhs, and they're not used in all the offices regularly. So we thought the existing equipment was expensive, not portable, and the software is also quite aged. Whatever we are using is from the past 5-6 years and changed much. So the idea was, now we are having these cell phones with very good cameras. So why not use these cameras to the imaging part and also take use of the AI analysis using an app. So the purpose was to develop and validate a low-cost, fully automated method of quantitatively evaluating the endothelium. So here, as I told you before, this is the camera that we are using. OnePlus camera for a OnePlus cell phone we have used, and we have developed an app, and we have attached it to the slit lamp. So the hardware is you need a slit lamp that has a high magnification, and smartphone should have, previously when we were using, we only had 2x optical zoom. Now the cameras come with 3x and 4x also, so you can also use this in regular slit lamps now. And a smartphone adapter that can be easily 3D printed or available in Amazon for 250-300 rupees. The most important part in this development was the software, which is AI enabled, where you can get the cell count, hexagonality, and CV like a regular specular microscopy. And you need an internet connectivity for this algorithm to work. So I'll not stress upon this technique because most of you know how you do a specular reflection. So when you do a specular reflection, this is how you see the, okay. So you see that second Purkinje image where you see that beautiful honeycomb. And when you go to the camera settings, we would prefer to have the ISO at 800 and shutter speed at 1/125. So that is the ideal for capturing the specular image. So now once that image is captured, automatically then we magnify that image, and this is the whole process in which it goes. It's called as the Krillhead algorithm, where it does a triple point analysis. So almost within 5 seconds, you get the results. So we compared the results of our mobile-based specular with the regular specular microscope clinically that we were using, and you can see that all the results are quite comparable. So in conclusion, I think smartphone-based imaging and automated analysis is going to be the future, where you want to have a good screening of the corneal endothelium. So the relevance and way forward, if we are able to get it into the market, I think it will be a very cost-effective tool. And this accessibility will make us to diagnose endothelial disease more accurately and improve patient outcomes. The thing that we are not yet coming out is the most difficult part is the capturing the specular image, because it requires a lot of time if you are not an experienced person. So now we are trying to automate that image capture also. The second Purkinje image, if you can automatically capture it, then it becomes even more user friendly. So that is the reason we are working on it. And I sincerely acknowledge my partners from Harvard GAMI. These young engineers from the Paulson School of Applied Science are helping me in this project. Thank you so much for your kind attention.
Thank you. And chairman, vice chairman, the panelist. Any questions you'd like to ask him?
I think you've already published this
In
article
a
in
TV,
National Institute of Health. Does it affect?
TVST, sir.
Yeah,
In TV.
I also saw it in National Health.
Okay, sir. Yes.
Does it not affect your patency?
Actually, patency, the US team is taking care. I'm not interested.
Anybody else?
Dr. Madhu, is it because we are not able to capture the images on a specular microscopy because of the haze and early
Yes.
edema?
Yes.
Do you think it'll be more effective in capturing images which are already not being captured on specular microscopy?
Exactly. That's a very valid point, because here you can capture the image in the area of interest. Whereas in a clinical specular microscope, they have a preset 6 areas where only it captures. That too, it will be off the pupillary axis. But here, if you are able to do the specular imaging in the area of interest, it will precisely capture that area.
Yeah, that'll be very helpful. I think that'll make a difference.
Yes.
Anybody has questions?
And what about the hexagonality percentage and CV
Yes, sir.
percentage?
Hexagonality, CV, and CD.
It's
All
a-
the three we get.
It's a different software.
No, sir. The same. It's an application, sir. Actually, it's an app in the store, which yet to be commercialized, but it's an app that comes, and it will, after you capture the image, within 5 seconds, it will give you the report.
Did you compare this with the gold standards?
Yes, sir. We compared it with both
What's your
NIDAC and.
standard deviation of count versus?
Yes. Can I go back?
You can just tell me.
Very comparable, sir. Not much of difference. In CV, some areas we had a difference, but we thought that was because of the areas in which we were capturing. There are two different areas that we are.
From a user point of view, who already have a now most of commercials are not that very costly.
Yes.
So where do you pitch your product in, for if you are to sell it?
I think every if given a choice, I would like to do a specular for all my cataract patients. I think that is where this would fit in for all the comprehensive ophthalmology.
So what would be your range of, what would be the cost?
Costs are actually, GAMI is a thing that is specifically designed for developing countries. So we want to keep the cost very accessible, and we don't want to have it a subscription model, but like a one-time buy, and it automatically gets upgraded.
Thanks, Madhu.
Thank you,
and keep innovating.
Thank you.